My fellow Americans, over the past several years, we have heard many voices speaking about vaccines and public health. Robert F. Kennedy Jr., a man with a face for radio and a voice for closed captionings, has questioned vaccine safety and mandates. Other public figures have emphasized personal freedom over public health requirements. Some leaders have sent mixed messages supporting vaccines in principle, but hesitating to speak clearly during outbreaks. Let me be very clear tonight. This speech is not about those individuals. This is about not about scoring political points. This is about something much bigger. This is about how measles outbreaks actually happen. It is about how a disease we once eliminated is coming back. And it is about whether the United States of America will still lead with science or drift in the preventable crisis. Measles is not a minor illness. It is one of the most contagious viruses known to humanity. If one infected person enters a room of unvaccinated individuals, up to 90% of them can become infected and most likely will. 90%. That's not opinion. That's epidemiology. And for decades, America controlled measles through vaccinations, specifically the MMR vaccine, which is about 97% effective after 2 doses. Because of high vaccination rates, measles was declared eliminated in the United States in 2000. Not erased globally, but stopped from continuously spreading here at home. So what's changed? The answer is simple, but unconfirmable. Vaccine rates declined. Measles requires about 95% community immunity to prevent outbreaks. When coverage drops below that threshold, immunity gaps appear, and when immunity gaps appear, outbreaks follow. This is not theoretical. This is how infectious disease works. Outbreaks are not caused by one speech. They are triggered by one interview. They are not created by one policy debate. They are the result of sustained declines in immunization over time. Now, can messaging from influential figures affect public behavior? Yes. Research in public health communications showed that when trusted leaders question vaccines, it can increase hesitancy amongst their audiences. Mixed messaging can create doubt. Doubt can delay vaccinations. Delay reduces coverage, and reduced coverage allows outbreaks. This is a chain reaction, but we must also be honest. Vaccines hesitancy. Vaccine hesitancy has multiple drivers. Pre-demic era distrust, social media misinformation, political polarization, historical medical injustices, industrial, institutional, and intellectual failures. No single person caused measles to return, but leadership, good or bad, always plays a role in public confidence, and that is where I stand. If I'm president, public health leadership will be clear, not partisan, not hostile, not dismissive, clear. We will tell Americans the truth. The MMR vaccine has been studied for decades. It is safe for the vast majority of people. Severe adverse reactions are rare. Measles complications, including pneumonia, brain swelling, and death, are far more dangerous. We will not shame people, but we will not whisper the science either. We will rebuild trust through transparency. We will fund local community partnerships because trust is built locally, not federally, amid opposed from afar. We will strengthen disease surveillance systems. We will ensure rapid outbreak response teams are fully staffed and funded. We will protect religious liberty while also protecting public safety in schools and healthcare settings. We will invest in education so that every parent understands how herd immunity works. Because herd immunity is not a slogan. It is mathematics. When enough people are immune, the virus has nowhere to go. When immunity drops, the virus spreads. This is not politics. This is biology. Measles primarily affect children. Children depend on adults to make decisions for them. Children cannot vote. Children who cannot lobby. Children who rely on us. Leadership protecting those who cannot protect themselves. It also means acknowledging mistakes. Public health agencies must communicate better. We must admit uncertainty when it exists. They must correct errors quickly and visibly. Trust is earned. But abandoning vaccinations is not reform. It is retreat. And America does not retreat from preventable diseases. We eliminated measles once. We can do it again. Not by attacking one another, not by blaming personalities, but by recommending, but by committing to evidence-based policy. By recommitting to evidence-based policy, by strengthening vaccination access, by ensuring clear, consistent communication, by referring to let science become a by refusing to let science become a casualty to politics. This is not about left or right. It's about whether we believe that preventable illnesses should stay preventable. It's about whether America leads the world in public health or fails behind it. When I run for president, I run on this promise. I will protect America's children. I will defend science. I will restore trust. I will protect the Constitution. I will defeat measles again. And thank you. And remember, Scott 2028.